Chronic conditions: arthritis, asthma, back pain, cardiovascular disease, cancer, chronic obstructive pulmonary disease, diabetes, mental health conditions. Think about all the things you would have to change about your life to manage a chronic condition. The framework aims to improve healthcare outcomes and reduce the impact of chronic conditions on the Australian population. The strategy can guide the way care is provided to patients living with chronic conditions. This framework is relevant to patient care as chronic disease is immensely prevalent throughout the world. The framework focuses on this through health promotion, appropriate illness prevention, limiting present health inequalities, and promoting autonomy through person-centered care. Matthew is a 7-year-old boy with aplastic anemia. His experience with this condition influenced my decision to become a nurse and has shaped the way in which I care and interact with my patients. Aplastic anemia is a disorder of the blood in which the bone marrow does not produce enough new cells. Platelets and red and white blood cells begin as stem cells, maturing in the bone marrow and then traveling into the bloodstream. Aplastic anemia causes the body's lymphocytes to become confused, leading them to attack the stem cells being created in the bone marrow. I've chosen Objective 2 from the National Framework for Chronic Conditions 2017, page 29, which outlines that effective, efficient and appropriate healthcare is available to all Australians. This objective has 5 priority areas that are central to the objective's overarching aim. Individuals living with chronic conditions may have multiple morbidities at varying levels of complexity, require increased and ongoing access to a range of medical services and support to self-manage their condition, and are likely to be receiving multiple pharmaceutical therapies. Actively engaging these individuals in their own healthcare with suitable involvement of family and carers empowers individuals to manage their health effectively and improve their overall quality of life. Zoffman et al. 2008 identifies that when individuals are empowered to make informed decisions about their healthcare, their understanding and confidence grows, enabling them to improve their health and maintain a better quality of life throughout the varying stages of their illness. For Matthew and his family, this played a role in the decisions they made about treatment preferences for his care, which were informed through the knowledge they gained researching and multiple discussions with the multidisciplinary team about possible treatment options. Continuity of care is the consistent, coordinated, and holistic approach to care across the health system to effectively manage an individual's chronic condition. Matthew's experience of this can be highlighted through the frequent hospital visits he makes to Sydney to update or maintain the treatment he is receiving. He weekly travels to his local hospital for routine blood tests and the cleaning of his central line. Accessible health services. This refers to physically accessible, appropriate, affordable, and acceptable health care services. Individuals living with a chronic condition require access to a variety of healthcare services across many different settings. An example of this for Matthew is the way the different healthcare providers communicated with each other. They could discuss Matthew's care together holistically, providing Matthew and his family with their recommendations for treatment for further care. The effective sharing of relevant, consistent, and secure health information and data between healthcare professionals improves the delivery of care to patients and their overall health outcomes. Matthew's leading doctor communicated with leading researchers and doctors in America about the treatment options for aplastic anemia. This improved Matthew's overall care and health as new treatments were brought in that provided him with a better quality of life. Supportive systems. This is when different healthcare systems work together to meet the needs of those living with chronic conditions. Matthew's care was organised efficiently by the multiple systems he required care from. Matthew had one leading doctor who discussed and communicated with the other systems and healthcare providers. Recommendations for Matthew would be to improve the awareness of the teachers and students at his school surrounding hand hygiene due to Matthew's compromised immunity. His fortnightly visits to Sydney could be extended to monthly, allowing him to maintain weekly checkups at his local hospital to reduce the amount of travel and time away from school.